My name is Jim Kriegshauser. I'm a general internist in St. Louis, Missouri, and I'd like to talk today a little bit about preventative health screening, primarily addressed to males. This is somewhat of a confusing topic because of all of the technologies and stuff currently available and the current interest in the general population and news media in health and health prevention. We're bombarded with thousands of alternative supplements and so forth that have very little data to support them as being useful. There are also a lot of high-tech diagnostic tests that, at least on the surface, make sense, but inappropriately doing screening tests with inappropriate screening techniques may and actually pose some risk to the individual, not only psychologically in the cost, but also lead to some dangerous and needless diagnostic testing. So whatever test that we recommend, there has to be a reasonable evidence that it is effective in screening and that by early screening it will make some patient, create some benefit for the patient. There is currently a body called the U.S. Prevention Services Task Force that screens, that actually evaluates based on evidence-based medicine, the efficacy and the usefulness of screening procedures. And this is, they have a website online, and this is probably the clearinghouse that most physicians use to establish their guidelines. For males, the most effective, or one of the biggest screening challenges is that of colorectal cancer. In males without other risk factors, that is family history of premature colorectal disease or inflammatory bowel disease, the current recommendation is screening, starting screening at age 50. The gold standard is a colonoscopy, which is most people are familiar with, but basically involves under light anesthesia, using a fiber optic instrument, looking through the whole colon. This is an outpatient procedure and is quite safe. There are circumstances where lesser procedures based on the patient's health might be appropriate. Typically, if this test is negative at age 50, it's repeated at a 10-year intervals. And the rationale here is that colon cancer typically develops from a benign polyp. That polyp takes years to grow and many years or several years to degenerate into a malignancy. And so we have that window of opportunity by screening every 10 years to pretty much effectively eliminate invasive carcinoma. These tests, again, this schedule is primarily for patients, again, without high-risk factors. Prostate cancer screening actually has slightly less concrete evidence to support it, but I think a general appropriate approach with our current state of knowledge is to start at age 50. Typical screening involves a digital rectal exam performed by a healthcare provider and a blood test called a PSA, which stands for prostatic specific antigen, that is done on an annual basis. And this screening is generally accepted to be appropriate between age 50 and 70. Beyond that, it would depend, again, on a variety of other health factors and medical conditions. The cardiovascular risk screening should in a male have occurred or at least start by age 35. This includes screening for hypertension, hyperlipidemia, that's high cholesterol, and fats in the bloodstream. If any of these exist, screening for diabetes mellitus should also occur. During this screening, in a physician's office, obviously counseling regarding diet, obesity, and smoking cessation it typically takes place. It's currently accepted, there is reasonable evidence to support the use of preventative aspirin. Typically in a male, this should start in the 5th decade. evidence currently suggests that the benefits of low-dose aspirin usually outweigh the risk when your risk of a cardiovascular event occurs is greater than 10% over the next decade. There is actually an online indicator, the Framingham Risk Calculator, that's easily accessible, where you plug in your cholesterol, your blood pressure, your weight, smoking history, and this will give you your risk of a cardiovascular event over the next decade. As part of the screening or the healthcare maintenance visit, the physician also will screen for depression and ethanol use, alcohol use. Most of us are well aware that excessive alcohol has all kinds of medical and social consequences, but most of us also probably don't respect that even moderate use of alcohol, more than 2 or 3 ounces a day, can also lead to a variety of other illnesses, including a significant independent risk factor for malignancies. Immunizations are fairly simple in an adult male. Tetanus, diphtheria should be done every 10 years. Usually at least once during the adult years, a whooping cough booster should occur, and this is typically done in conjunction with the tetanus, diphtheria vaccine. A shot for herpes zoster, that's shingles, is recommended at age 60, and at age 65, pneumococcal vaccine. Both of these are just once a lifetime vaccines. There are obviously other specific vaccines based on your work and travel exposures that may be appropriate, particularly hepatitis A if you're a food service worker or doing any kind of third world travel. In summary, or to kind of recap, again, we've talked briefly about what criteria we use to determine what's an appropriate preventive medical strategy. We've talked about a reasonable schedule for testing and immunizations, and talked a little bit about lifestyle modifications. I hope this has been of some benefit.